Hey guys, Oscar here with Gastroenterology Simplified. I hope you guys are having an amazing day today. I'm a board-certified physician assistant, and today we are going to talk about diverticular disease. Before we go any further, I want to make things clear. This video is for educational purposes only. If you have any questions or concerns, please contact your physician assistant or primary care physician. Today we are going to touch bases on diverticular disease. Diverticular disease includes diverticulosis, diverticulitis, and diverticular bleeds. Let's go ahead and show you here in the board. Diverticulosis is when the colon has pockets, and the pockets look like this. The colon has developed pockets throughout the year because the typical American diet, lack of fiber, lack of proper hydration, and so on. And with advanced age, the diverticulosis tend to increase throughout the ages. That is the basic on diverticulosis. When someone has diverticulitis, which is the inflammation or infection aspect of the diverticulosis, then one or some of the pockets become inflamed. So it has inflammation or an infection of one of the pockets. Some of the most common causes of diverticulitis is advanced age, lack of fiber, sedentary lifestyle, lack of hydration, obesity, just to mention a few. When someone has diverticulitis, usually they tend to have pain in the area affected. So for example, in the sigmoid area, let's say the patient has diverticulitis in the sigmoid area, then the patient is going to have tenderness in the left lower quadrant area, usually around this area. What do you do when someone has diverticulitis? You start antibiotics, hydration, low residue diet, and then once the episode has resolved, you make sure that the patient is on a high fiber diet, and the patient will need a colonoscopy between 6 to 8 weeks if the patient is not up to date on the colonoscopies. So we have that clear, right? Now let's go ahead and move on to diverticular bleed. Diverticular bleed is when one of the pockets happen to expose a vessel, and then the vessel starts bleeding. So that's diverticular bleed. Necessarily, the patient does not have to have diverticulitis to have a diverticular bleed. If the pocket is big enough and it happens to expose a vessel, then the patient is likely to bleed because of the exposure of the vessel. So what are some of the most common causes of diverticular bleed? Well, we have lack of fiber, lack of hydration, obesity, hypertension, smoking, advanced age, use of NSAIDs such as aspirin, Aleve, ibuprofen, BC-Guru powders, naproxen, use of anticoagulation such as Plavix, Eliquis, and that increases the likelihood of diverticular bleed. Usually when someone shows with lower GI hemorrhage, the first thing you want to do is the patient on anticoagulation, NSAIDs, you want to stop that. You also want to get a CT angio of the abdomen and pelvis to make sure that they don't have a severe bleed. But when the patient has a diverticular bleed, usually the CT angio of the abdomen is negative. And the best thing to do is bowel rest, maybe a clear liquid diet, and stop the actual anticoagulations such as Plavix, Eliquis, and NSAIDs, if any. So you want to go ahead and give the patient IV hydration, monitor hemoglobin. If the patient needs transfusion, then you need to transfuse some blood and monitor the patient If the patient continues to bleed, then you need to consider a colonoscopy if necessary. And this is the difference between a diverticulosis, which is just pockets throughout the colon. Diverticulitis, that's when you have inflammation of one of the pockets. That's when you have inflammation of the pockets. And diverticular bleed is when a vessel in the diverticulosis in one of the pockets happen to be exposed, therefore the patient tend to bleed. Usually the patient shows up with severe bleeding per rectum, but it's usually a diverticular bleed, and it usually self-resolves if you do conservative management with IV hydration, stop the anticoagulation, and stop NSAIDs, transfuse blood if necessary. I hope this video was helpful. Once again, this video is for educational purposes only. And if you like this type of video, please click like, subscribe so I can bring you more videos like this. And the best gift that you can do is to share this video, click like, subscribe, and I will see you on the next one. Bye.